Welcome. How to treat a pulled muscle. What's the best way to treat it? Now, obviously, there is a program to follow. It's called RICE, R-I-C-E, rest, ice, compression, elevation. Now, obviously, if you hurt your arm or your leg or your knee, you want to go ahead and you want to rest it. You want to ice it, and you want to compress it to keep the swelling from continuing, and you want to elevate it. So that means you want to hold it up above your heart initially. That's important, but what if you pull a muscle in the neck? It's hard to elevate it, it's hard to compress it. What do? The most common everyday pulled muscle generally comes from behind the neck. The head being 12 pounds, for every inch it goes forward, it's an additional 10 pounds. As it continues to go forward, that stress multiplies. Those muscles have to overwork. So you at the computer with your arms elevated, driving, looking down, texting, whatever you may be doing, that excess stress causes a lot of weakening and pulling on that muscle. Over time, micro trauma starts to cause that muscle to contract and spasm. Also, waking up incorrectly using the wrong pillow, sleeping on your stomach with your head turned to the side, pillow may be too high or too low. That will usually cause those muscles to contract. So when you have this contracted muscle, generally you'll notice that it's hard to turn one way compared to the other. So obviously when the muscles contract, you want to take that shortened muscle and you want to go in the opposite direction and just hold it. Hold it about 20, 30 seconds and do that multiple times. Initially, if you just pull a muscle from a trauma or an injury, you want to use ice. After the first 36 hours, moist heat or generally heat is good for about 20, 25 minutes several times throughout the day, but stretching is very important. One of my favorite techniques is called proprioceptive neuromuscular facilitation, PNF. PNF is a form of a neuromuscular re-education type of exercise that you can trick the brain. For example, if the right side is causing contraction and I want to stretch that muscle there, I'm going to pull it away from the shortened muscle. As I pull it away for about 5 seconds, and what I'm going to have you do on yourself is that you're going to go towards the muscle with my hand. I'm going to resist it now and push back towards the muscle. You hold it for 5 seconds. Keep pushing and resisting and relax, and then stretch it a little more forward. And you're going to do the same thing again. You're going to push back towards the muscle as your hand restricts it up here for 5 seconds as you're resisting. Relax, and then go ahead and let it stretch more. As you do that particular method, you're going to elongate the muscle each time. You're going to trick the brain so the muscle spindles can continue to reset within that muscle region. The other particular thing is cross fiber massage. If the muscle is contracted and the fibers are running this way, by getting in those fibers and massaging it across the opposite way, you can dynamically increase range of motion tremendously that way. So the most important thing for you to do is to be on top of this early. When you leave muscles contracted for long periods of time, they're much harder to correct if there is particular adhesions present, which is scar tissue or things that are actually healing incorrectly. If you have questions, leave them below. I'm sure you will. I ask you to share this video with others so they can benefit. Subscribe if you haven't so you can continue to receive more self-help videos for you, your family, and loved ones. And most important, I ask you to make it a great day. I'm Dr. Mandell.